Hi, it's Dr. Centeno, and I'm going to get into today curve correction, a deep dive. Now, this is part of the Rehab from CCI series under rehab strategies. We're going to get really deep into this topic. So like, comment, share, and subscribe, because if you do that, you can get this information out to even more patients. So this is a three-part series. This is under rehab strategies. And then we're going to really dive deep into the curve correction part of rehab strategy. So rehab strategies and interventions. Rehab strategies are conservative things like chiropractic, curve correction. Interventions are minimally invasive things like image-guided orthobiologic injections or surgery. Now, the first question you have to ask yourself is, do you even have a loss of neck curve, also called a loss of lordosis? If you do, then this part of the rehab plan is for you. If you don't, then you don't need to worry about this. So the first part, if you have a loss of normal lordosis or a loss of curve, is to try a towel test. And that's trying to answer the question, are you ready for curve correction? So really simple test, you just roll up a little hand towel, put it right behind the back and the center of your neck, lie face up on a firm surface. And if this improves your symptoms, you can obviously experiment with how big or small you make the towel, and it generally feels good, then you're probably ready for curve correction and for everything we're talking about today. If it just causes more symptoms, then you're probably not ready for that, and you may need an intervention like precise orthobiologic injections to get there and to be able to tolerate curve correction. Now, the other possibility, if you are ready for curve correction, you pass that test, are home devices. And there's lots online to improve the curve. So you can buy these online and you can try them on your own at home. Again, if it's too much and if it increases your symptoms, then you got to back off of this, and you probably will need some sort of intervention like posterior injections or a PICL to tolerate curve correction. Now, if you can tolerate all of that and you're doing well and you want more, then there are actual specialists out there in chiropractic biophysics at idealspine.com. And these are folks who specialize in getting the curve back using in-office devices and at-home devices with supervision. Now, what I would not recommend is any type of neck weights. I've seen too many patients get too flared up from neck weights. That is not part of routine curve correction. But I would recommend going to this idealspine.com website to try to find a certified provider near you. And realize that scoliosis is another part of the curve. Rather than front back, this is side to side. So it's a side bend in the spine. And if you've got scoliosis, then you may have to address that as well, and that's Schroth physical therapy. This is a physical therapy discipline that focuses on restoring the normal left-right balance, and realize that scoliosis can cause CCI-like symptoms as well. So it's another reason to try to get that left-right balance back in your body through physical therapy. So in summary, restoring your normal neck curve can help offload the upper neck ligaments, critical point. If you have a loss of normal curve, first see if you'll tolerate curve correction. If you can, then you can consider at-home or formal in-office curve correction through the providers I talked about. And if you can't advance and you can't get in this direction and it's increasing your symptoms, then that's probably when you need precise orthobiologic injections like posterior injections or PICL, depending on what type of CCI you have. And if you've got scoliosis, consider Schroth physical therapy. So thanks so much for watching. Like, comment, share, subscribe, because that's how we get this out to more patients like you. Thank you.